Hey guys, this is Tiara, your lead practice and educator nurse. So today's video is going to be dedicated to tips and tricks on how I answer NCLEX style questions. I am currently a senior in my RN program. I am also a mother of three. I've been married for 12 years. I am an Army wife. So yes, I got a lot going on, guys, but stay tuned. I wanted to do a little quick video on this because I feel like we all can relate for those that are in nursing school or maybe getting ready to start and you practicing your questions already. Nursing school exams, we know how it can be. For those who don't know, I'm going to share. But anyway, welcome to my channel. For those who are new, please subscribe. I am new to all this, but I love YouTube. That's like my go-to since I started nursing school. I am a visual learner, so I literally have to see what I'm doing before I do it. I just can't read a book. But anyway, so we're going to get right started on this video. So tips and tricks that I notice now that I am currently an RN student. Like I said, I'm also been an LPN for 4 years. So I'm still kind of new out of LPN school as well. So let's start with tip number one. Okay, first of all, guys, we know nursing exams can be like, what are they talking about kind of exams? They look so simple, but they are a little difficult if you don't know the style of questions that you may get on your exam. Now, for those who are just starting nursing school or have been in there for a while can relate, some nursing exams may have questions where it's true or false, or select or apply, or maybe it's just multiple choice, or you drag over. I had essay questions, yes, where I had to type out my answers, so yes. Anyway, I had all forms of exams. What I learned now, guys, I want to say years down the line of keep doing all these questions, is you have to learn how to answer a nursing question. And here's a little faster way to do it so you can get those A's and B's in school, because my program, I have to have 80 on literally the end of the term. And I have 5 weeks per term. So I have no room to sit here and try to learn and master something. Literally, I have to take it in, spit it back out, and just hope for the best. But anyway, so I wanted to talk about things that I'm noticing that is mainly on all NCLEX style questions for nursing school. First of all, nursing school is going to have a variety of way they're going to test you, but it's all going to be like the same nursing type of stuff. It depends on your class that you're in. Right now, I'm in my last term, so I am in acute care. I did my med-surg 2 class last term, and then before that was labor delivery. Like, we was all over the place. Usually your exam should match the class that you are in. And sometimes it'll be some extra stuff on there, but we're going to talk about that. So the tips that I noticed when I look at an exam now as a senior that I didn't catch a while ago, I had a problem with maybe some test anxiety. I self-doubt when I'm taking an exam, and sometimes I'll put the right answer, then I will change it and freak myself out. And I'm the type of test taker where if I'm finished my exam, I have to press submit right away, because if I don't press submit right away, I will probably change some answers if I'm taking it on paper. Now most of my exams are on my iPad, or I log in on a lockdown browser and we take our exams that way. And we're not allowed to go back. That's the NCLEX style way of testing. But most nursing knowledge will come from like your ABCs, with your air, rate, breathing, and circulation. It's going to come from your Maslow hierarchy of needs. We know about the basic needs. It's going to be on stuff based like that. But what I learned is, where my style questions maybe in my program, our class exams are like paragraphs long of when you get a question. So it may be like an 86-year-old coming to the emergency room and is bleeding and broke their arm and fell, and they lab values is this, and you notice that, and da-da-da-da. What is your nursing priority? What I used to do was read the whole damn thing and then sitting there like, I don't know what's wrong with this person. It seems like this person got a lot going on. A lot of the stuff that's in the question is just a distraction. Now, as a senior, and I've been in school for a while, guys, I read the last part of that question. What is my nurse priority? Each question is going to give you a hint to what the answer is. And I feel like since I have only 5 weeks a term, I can't read every little thing and put all that knowledge in about that specific subject. But literally, I can get a lot of questions right if I just learn how to test, like how the questions are formed and how to answer it. And I study more the options. So what I mean when I study the options is I was always taught as a tip, if you see two of the same kind of option for your answer key, then you automatically delete that. Now, if you see, the same, like if they're the same, like, okay, temp is 101, then you'll see that for option A, then option B is the same thing. Then you know it's not that. But if it's the opposite, meaning like, okay, the temp is lower or the temp is higher. So you know either or, lower or higher is going to be your answer. That's the kind of stuff I'm talking about that I'm noticing that helps me much better and take my test much faster. Most of my exams in school now are 100 questions or more. I have an hour and 40 minutes, yes. So I have to move pretty fast. Another thing that I noticed is when they say priority, they really mean just what is that best thing that patient need at that moment. So, and that comes with time. All the stuff I'm saying, it comes with taking practice questions over and over and over again. You learn how to test. Like, I feel like a lot of people are very smart, but when they get into nursing school, they may not be a good test taker, and that's okay. Not all of us are, and it really comes with just practicing. But I'm noticing things like small things like that always help. Or like if they give a whole bunch of labs, which lab is abnormal. I'm not even reading like the whole paragraph of the question. I'm just looking at my options and saying, okay, this lab, this magnesium is not normal. You know, maybe all the other ones are normal. Now, it may get difficult where maybe two of them are not normal and you're like, well, which one relates to my patient? If we're talking cardio, I know I'm going to look more towards my potassium and my magnesium. So anyway, like I said, it comes with time. But I noticed that, like, so we said that if it's the same answer, then we know that's not it. We eliminate that. But if it's opposite, low or high from each other, if the answers is opposite of each other, it's either one of those. Another thing that I always notice that's an answer on the test that you can get right is wash your hands. Literally wash your hands. Please don't dig so much into what they're saying in the question when they type this stuff out. Look at your options. Wash your hands is always your best way of preventing infection. Like, don't get so into the isolation. Just literally wash your hands, soap, and water. Like, that's always the big thing. Another big thing on tests that a lot of the answers are about safety. Let's talk about what to report to a provider. What is the main thing you will report to a provider? Look at your options instead of reading so big into your questions. I'm noticing now I'm much faster and much a better test taker now because of that. I look at my options right away. Okay, I know if my patient has a, let's say, has a temp of 99, but they're having SOB as well. I know I'm going to report the SOB first. They short of breath, if that's what SOB means. They're having respiratory issues, again, ABCs. I'm like, I know I'm reporting that first rather than worrying about a temp. So I'm learning how to study these tests, and like, it's amazing. Like, you can test much faster and have more confidence because you're like, oh, I really don't really have to know the material like down to the wire. I just have to know how to test. Let's see. Another thing that I notice is that when you're reading these questions, just know that a nurse always has to do something. So I used to always be like, I'm going to consult with the dietitian or physical therapy or whatever on my answers. And that's always wrong because you, as a nurse, they want to see what you're going to do for your patient. You always going to be doing something rather than saying, hey, I'm going to just call a doctor. Always start with your low interventions before you jump to your high ones. So if we're talking about safety, I will put my SIRELs up, you understand, before I report to the provider that, okay, this patient about to fall, or I think I have to do something for my patient first before I call the doctor. Anyway, if you call the doctor, they're going to ask you thousands of questions. So always, this in real life, you always do something for your patient, minimum, and then work your way up. For drugs, sometimes that pop up on my exams, which we have a lot of drugs that pop up sometimes. I learn them by class. I cannot do it, and I can't study drugs. When I did pharmacology, I can't study it individually. I have to study them by class, my LOLs, my PRINEs, and literally you could go on YouTube and find awesome people that know how to break these classes down. And then it's so easy to recognize something. Another thing that I noticed is, I want to say, some questions on your exam, you have to know it's going to be a question where it's like, you know it or you don't. And then there's some questions, like select all that apply. Those could be a little difficult because if you get one wrong, then you got all of them wrong. It depends on your instructor. Some instructors may be like, oh, you may get partial credit if you got one of them wrong, but you got the other three right. Those could be a little different. But like I said, a lot of things that I do now is just practice questions. And I'm like, oh my God, this is so much better than sitting here trying to read, because I am a reader. I would read. It got me through the beginning of my program, but once shit hit the fan, like at the end of my program, I lost half my class because people were becoming a little bit too confident, like, oh, you know, I got this, just another term, you know, it's just med-surg 2. Med-surg is heavy, so it's not just med-surg 2. Med-surg is like the bulk of everything. It's the foundation of nursing, and especially when you transition to LP and the RN and all that stuff. Like, a lot of med-surg was like hell. But I learned that my test taking skills need to be improved, and the only way to do that, like I said, is to really practice these questions and look at that last part of your question. What is this? What would you report? Which lab is out of this? Because that's all you're answering. When you start reading that whole thing more than 3 times, then you start to get it wrong. Everybody's different. This is just my theory on it. I know if I read too much into it, then I'm visualizing the whole process, because I'm visualizing the whole process and all this stuff. And it's just like, no. And I don't have time on my test. I only have a certain amount of time to take all these hundreds of questions. So yes, I find taking like ATI exams, I usually do good on. Like, we usually have to reach a level 2 nationally, and I usually reach a level 3. A reason why with that, I just feel like they're more straightforward. You know it or you don't. And it's literally like nursing exam that matches that subject. Like school's exams, sometimes their grammar is misspelled, or like you don't know what they talking about. Like sometimes they put random stuff on there, and you're like, we didn't learn that, we didn't cover that, and they expect you just to like ace it. So school exams, sometimes I don't really do so well on. I mean, do my best on. I pass it, but it's not like super high scores. And guys, when you're in nursing school, just enjoy getting whatever passing grade is it for your school. If it's 75 or 80 or 90, whatever, and just appreciative that you passed. A lot of people are struggling more than you know. Like, just don't complain about your success, and keep it to a minimum. Everybody don't need to know like you doing so good, because some people are they just don't know how to test. In nursing school, you are going to be hit with different styles of questions. And like I said, I used to pay attention to the whole paragraph and be still sitting there reading it over and over again, and thinking I'm a provider. Always think like a nurse with no experience when you're taking these tests. So if you have like LPN experience, or you CNA or whatever as medical assistant, go in there with a clear mind of exactly what you learned in that class. And like I said, I learned different tips and tricks of that as far as how the question is being presented. I read that last part of that question, and then if I have a question where it's a little complex and I need more quick cues, I'll only read certain parts of that question. And I'm like, oh, we're talking about, like right now we're talking about fractures and external fixations and pins and needles and stuff like that. So, you know, I look back in that question and say, hey, okay, I didn't cover this, but from my way of testing, I would put this because of, I wouldn't do that, you know. Like I said, always know that as a nurse, you have to do something. So when you answer these questions, if your patient presents with something, don't, just like, oh, I'm gonna consult the provider. No, always check them. And that's another answer that's always on the test is assess. That's always going to be the answer, is to assess, because that's what nurses do. We assess. I mean, especially RNs, we assess. So that's always another answer to the test. Trying to think what else is usually on. So that's usually right. Washing your hands is usually right. Always big on safety. Always start with the minimum intervention and work your way up. If there's a drug and you're unfamiliar with the drug, look at the end of the drug, those last couple of letters, and if it may help you, because if you study by class, then you would know that, okay, ACE inhibitors has a dry cough, and the beta blockers, they do that. There's a few times that helped me out because I was like, I don't remember that drug, but the ending like literally saved my life because I know the class, and so it brought all that knowledge back to my brain. Now I'm 31, so my brain has a lot of stuff in it, and sometimes I get the information confused because I'm putting too much in it. So I'm just learning now that I'm in the end of my program just to study how to test, like how to sit there and test. And another thing that I do to be successful on my test is I try not to be with people that are freaking out. Like that really can mess with you, like, or somebody's negative. Like you always sometimes may have a negative person in your class, like, oh, we're gonna fail this, or I'm failing this. Like I can already tell. Like one girl already said this term, I'm failing this the third test, and da da da. When I get ready to take my test, if we have time before, I go outside, I breathe in, breathe out, and I stay away from the comments and the negativity when everybody's trying to calculate their grades and all that. I just come in, I literally sit down and take my test. I'm more like an independent student. I don't do too much of the group studying. Some people do that. I don't. I do it better when I stick to my routine. I sit at this table, Can't see my table, but I sit here and I don't move. And I literally study from in the morning to 5, 6, sometimes 7 o'clock. Last night was up to 3 a.m. going through practice questions. And like I said, now as a senior in RN school, I am learning better ways to test. Like literally, like I was taking forever doing the test because I was reading a little thing. And now I'm just learning, I got that right, got that right. Like I go through it so much faster because like literally I'm like, okay, I didn't read all the material yet, but I know that it's just saying, hey, what do I need to do for my patient right now? And some things are common sense, like if the patient is bleeding, you're going to apply pressure. You know, you're going to assess, you're going to check the skin. And it's going, like I said, it's going to come with practice questions. Another thing that I use is Quizlets. Now, Quizlets could be helpful in the beginning of your nursing program when your classes aren't so rough when you're at. Literally you can look up a topic or like pharmacology or like med surge, and like different tests will come up that people put up on there, and literally they create flashcards and like you can review like some of the questions. Sometimes you may see a question on your test that was on Quizlet, you may not, but it's very helpful. Everybody uses Quizlet that I know of since LPN school. Like, and you create your own flashcards. You can download it on your phone. It's free. You can create your own flashcards. I used to do a lot of flashcards. Now I am just like literally as a senior, I have nothing in my backpack because I'm like, you learn what you just need, you know. And I prep for all my national exams the first week or two of the class because I only have 5 weeks of term for my ATI national exam that I take like for each subject, like pharm, med surg, whatever. And I watch Kathy Parks. She has a YouTube channel and she is the best, guys. Y'all need to check her out, especially when it comes to pharmacology and all this stuff. Like she just hits the points in your ATI book. Like I love her. I had level 3s because of her. Everybody always asks what I do. Literally, I go through the book with her. I pick a day just where I do ATI all day long, ATI. But anyway, that's how I test. Now, guys, put some comments below. I don't know, maybe you have some tips and tricks, but literally practice questions that helps, and see why you got things wrong. Like I'm more concentrate on the things that why I got that question wrong, and then try not to do that again. And your nursing knowledge and experience will build over time. And not all the time that helps you on exam, but what will help you is making sure you actually practice the questions, and you'll be like, oh, I know how to answer these questions now because I don't pay attention to all the fluff. Like I just get to the stem of the question and answer it. Like If it's talking about pancreatitis, inflammation. Okay, this patient is having inflammation, redness, swelling. Okay, what am I going to do for my patient? Like, simple ways of thinking about the question rather than be like, oh, man, it's pancreatitis. Let me see. The etiology of that is, by the time you do that, you know, you run out of time. And that's the worst thing you can do for yourself when you're doing, like, exams, is just to run out of time because you're a slow test taker. And you really don't want to self-doubt yourself. Come in confident, come in with eating. I already make sure I always eat or drink something before my test. One time, guys, I had an issue where I actually didn't even finish my test because I had to pee so bad. And I was running like behind. Like, I will always make it to class like 2 minutes before it's time for class. And like, they was already sitting down ready to test. And she was like, come on in. Then I didn't use the bathroom. So now I'm trying to hold it. I couldn't even hold it. I was like, oh, that made me fail one of my exams. So I had to work on my time management. So yes, when you come to a testing day, you come in early, you sit down, and you just start. Like, some people try to cram a couple of more things in your head. If you're trying to cram the day or a few minutes before the test, that means you really didn't study as good as you should have. And you're not going to probably remember half of that stuff that you're trying to cram in. And now, yeah, you're causing stress. So I wouldn't recommend that, but some people try to do it. My advice would be, if you have a test the day before, is to just review, because it'll be fresh in your head. I like to review early in the morning. My brain is so fresh in the morning. After a shower, I get up, have my cup of coffee, and I hit my books. Like, once I take care of my son, my 2-year-old, I hit my books, like, nonstop. But anyway, that is tips and tricks. I hope I was helpful. I was trying to think of other things that might come up for your testing that can help you. That's universal. Now, everything I'm saying, everybody, it relates to mostly all nursing programs that I've been in. And sometimes you really do have to just read your book, like, just a lot of times your answers is in those tables and charts and stuff. Like, your teachers love taking stuff from that. So I don't know if that's helpful. You don't have to read every little thing. In the beginning, I was reading every little thing. It was helping. I thought it was. Like, so when it came to my final, I like always do okay on my final because I read, like, so I knew the material. But as a senior, they're just having you do thousands of these prep use. We do prep use questions that come from our textbook, and some of them be on our exam. So we literally have to do thousands of them, and it takes forever. But it teaches you how to test, and I think that's what we need to know where you in nursing school. It's like literally how to test. Like, how am I going to get like a passing grade? Literally see the format of these questions, and then what, like I said, take the fluff out. Some people look at their answer options before they read the question. That's another way. I literally just go to the bottom part. Okay, what's my priority? And just look at my options. And then look in for the hints, because there's hints in almost every question. And know the basics, like ABCs. Know your math law. Know safety is important. When it comes to talk about preventing infection, you're going to wash your hands. If there's a problem that come up, you're going to assess. Know your lab values, what's abnormal, what's normal, because that's usually on your test, especially in med surg. Far as drugs, look at classifications of your drugs, so they all relate and do the same thing. So if it's sedation, everything is going to be hypotension. The patient's going to be risk for fall, so you're going to be looking for that in the question. So your experience will come with time. Being in school and learning those things, those main nursing concepts, are definitely going to be in your head, and you're just going to be like, oh, okay, I'm a nurse, so this is how I'm answering these questions. But yeah, I always try to visualize. If I'm stuck on a question, try to visualize it and make sure I'm reading it correctly. And a lot of times, our book has a care plan in all the chapters. And that's how some of the test questions are being asked. Like, what is your teaching plan? Especially as RN now, everything is teaching. What is your instructions if they're being discharged? What is your teaching plan? What is the appropriate diagnosis for this patient? Oh, if you look at it, it becomes so much easier as you've been doing a lot of practice questions. Because you're like, okay, nursing diagnosis would be risk for fall, risk for infection. They just came out of surgery, right? You think... And if you had surgery, use those experiences. If you don't have no nursing knowledge, use your experience. I had some experience with myself, so sometimes I use that. But yeah, so things like that, simple things. A lot of times we think too complex. Like we like, oh, the answer is da 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 da. Like if we're doctors, we're not. We're just nurses. And yes, so you just need to really just stick in the nursing lane and do what you need to do for your patient. What can I do for my patient right now? You know, now mental health can be a little difficult because mental health questions is a little bit different than what you would normally do for your patients in the mental health setting. And if you haven't been in a mental health setting, it's really hard because I had a hard time with mental health when I did an LP in school, and in RN school, I liked it a little bit better. I remember the drugs much easier and everything, maybe because I like psych, but I didn't get it in LP in school. I was just like, I don't understand. Like, and it's the opposite of what you would normally respond to your patient. So you may be more listening to your patient and more reassurance of your patient and encouraging rather than straightforward things, because you're dealing with patients with mental health issues. And if you talk about mental health, you want to look for the risk of suicide. That's always an answer on your test. You want to assess for risk of suicide if they want to harm themselves. You always want to talk about safety with them. And usually mental health is a lot of the drugs. So you would definitely want to dig into your pharmacology. Like I said, learn the endings of the drugs, what they can do. Let me see. Another thing I find difficult for a lot of students is pharmacology, because pharmacology is huge. It's how the drug goes in your body, how it's absorbed, the whole process, different routes of giving the medication, the side effects, the adverse effects, and all that stuff. I would say get a good drug book. I have the Davis drug book. I'm going to show you it. So this is what I used since 2016. No, 2015. This book is amazing. Some schools give it for free. It's amazing, guys. Like, I use this. I'm going to use this for my whole career because it's just so easy to use. Like, literally, you find your drug. It has this whole thing written out for you. And especially as a student, when you're like, I don't know no teaching. What would I teach? What's my nurse implication, labs, and routes, and dose, and interactions, and contraindications, and all that. What would I look for? What's the class, pregnancy category? Is all there. Like, I love it. Not all nursing books are so thorough like that, but I literally love this. Like, I just love it. In med surg, we do a lot of drugs cards, so this is like my go-to book. I don't know how much it is online, but this is an older edition. I'm sure like they got the new one, but I don't care how bulky this thing look. Like my Bible. This is my Bible for nursing. I use this book so much. It's not funny. Davis drug book is the best. Like, I just love it. I know they have an app and everything for it, but I like old school looking at the book, like looking up my drugs and everything. So sometimes when I come across a drug in clinicals, I will look it up in here when I'm doing my care plan. I love this book. Like, people was trying to take my book, literally. That's just how good this book is. Like, it's so simple. Some books, you really, it don't give you that much information in that drug, and sometimes they don't have all the drugs in it. So be careful which drug book you pick. But that's a good one for people who's new with no experience and you just want to have some broad knowledge of drugs. There you go. Another thing is look on YouTube. There's some songs and people come up with dances on how to remember certain drugs. Those are always pretty cool to look at. I'm visual and kinesthetic, so I either have to see it or do it. So that's how I learn. So figure out your learning style, and then once you get your learning style, if you're auditory, you can record your lectures. If you're visual, you can look at PowerPoints, rewrite your notes. I mean, if you're kinesthetic, you rewrite your notes because you're moving your hands. If you're visual, watch a show on YouTube on how to remember. Like, somebody has something up there on how to remember cardio drugs, or like different heart blocks. This guy was doing like a dance to different heart. Oh my God, just YouTube has so much amazing content. Like, but guys, please subscribe. I'm definitely going to be hooking y'all up with some new content all the time. Hope I'm not just running my mouth, but I was trying to be helpful because I feel like we have to do this. Like, nursing school is doable. It's doable if you put the time and work in. You can't be a lazy student and look for other people, look for shortcuts and looking for other people's notes. Sometimes people take notes from other people. I don't do that because, like, it don't make sense to me. Your notes is your notes. My notes is my notes. Some people type up their notes. Some people rewrite their notes. Some people just have it on their iPad. They copy and paste. Whatever it is that you got to do, get your good notes going. And that way you have something to refer back to. And a lot of things you're going to remember. And once you get to the end of the program, you like, got your shades on, and you're like, look, I don't even need all that. You get to the end of the program, you know by then what to do. But do the work. Put the time in. If you know you got a test coming up, study that prior, like a week prior. Don't be 2 days before the test trying to get all this content in, because it's just difficult trying to get everything in your head. You want to give yourself time, and you might need to break it up. Me, I like to get all of it in one day and put it in my head, and then I come back to it the day before the test and review. Now, when I'm studying for my ATI, through my whole ATI book, I go with Kathy Sparks and pick a day and start from early in the morning to the end, and she goes through the whole book. And I just only highlight what she goes on, and that's the way I study for my ATI exams. Final, I really don't push for finals, because finals in my school is only 20%. But mostly my exams are 60%, so you have to ace those or do really good on the 60%, because that's your grade right there. But anyway, I want to just be helpful to you guys out there. I know nursing school can be like, in some of those exam questions, you like, what are you talking about? Like, yeah. So anyway, I wanted to put that out so that you can learn how to take nursing exams. Look at the bottom of those questions and do lots of practice questions, lots of them. NCLEX style questions, because that's all they're going to be pushing on you anyway. And when I say NCLEX style, that's your boards when you get out of school type of questions. Like, so they're only nursing knowledge. Like, they're looking for that nursing foundation that you're supposed to have by now. So anyway, this is your lead practice and educator nurse Tiara, coming to you with another great video, guys. I am definitely going to be putting some more content. Those who are subscribed, thank you so much. I know I'm just getting started. I know sometimes my son, you can hear him in the background. There's so much going on. But I'm just super excited to be able to share. I've been doing nursing since 2015. So it's been a journey. And I'm now about to end it and be on the floor again as an RN. I was on the floor as an LPN, but now I'm changing my role. So congratulations to me. And I'm super excited. Also super nervous, but super excited. I'm going to be doing next a video on how to pick a nurse specialty and talk about the preceptorship and all those goodies, what to expect, because I'm getting ready to go through mine next term. So anyway, so stay tuned, guys. Stay tuned and have a blessed day.